Cooper Allen. I will be presenting on acute stress disorder. What is acute stress disorder? ASD, otherwise known as acute stress disorder, is a short-term mental health condition that can occur within the first month after experiencing a traumatic event. It can happen to anyone at any age. If you're a child, adolescent, teenager, adult, elderly, does not matter, you can still suffer from ASD. Some of these events could include a major illness, a major injury, loss of a loved one, a car crash, any sort of major accident like that, natural disasters, physical or sexual harassment, anything that can or could qualify as a traumatic event could potentially cause ASD in you. Symptoms of ASD include anxiety, an intense feeling of helplessness and fear, experiencing flashbacks of the traumatic event, feelings of numbness or detachment from the body, avoiding anything and everything that relates or could relate to the traumatic event, recurring nightmares of the traumatic event, and difficulty sleeping, just to name some of the symptoms. Causes and risk factors. Traumatic events are the main and only cause. They will cause the ASD to suddenly develop, which is bad enough on its own, but can present the individual with many issues down the road. Different events have different rates of causing ASD. For example, survivors of a natural disaster typically have lower rates of ASD when compared to survivors of mass shootings or assault victims. The rates of people who get ASD from their events can be from anywhere between 6% to 33%. Risk factors may include a history of prior mental health conditions, such as prior trauma. Another factor which can cause ASD is an avoidant coping style, which is a maladaptive coping mechanism where the person avoids, ignores, or disengages with stress-inducing situations rather than addressing them directly. Moving on, something I noticed is there is a very distinct difference between PTSD and ASD. While both are similar mental disorders, the biggest difference between the two is the length of the symptoms. ASD, while it develops in the first month, ASD will directly develop into PTSD if left untreated. Acute stress disorder will typically last anywhere between 3 days to 4 weeks following the traumatic event. And if it is left untreated, it will stem into PTSD. It can meet the criteria to become PTSD. Now, normal versus abnormal behavior. The biggest concern of ASD is it developing into PTSD. Although where you have it, ASD can cause an exaggerated response to loud noises, sudden movements, or any other sort of stimuli. Alongside that, people often experience hypervigilance, which is putting an excessive amount of attention towards their surroundings, looking for anything that could possibly be a sign of danger. Constantly looking around, being very high on alert, being very high-strung are all side effects of ASD. Difficulty feeling positive emotions, such as happiness, any sort of contentment or love, those can all be very difficult to manifest in someone who is suffering from ASD. They can have aggravated outbursts, typically stemming from irritation or anger. They're much more quick to these feelings than the average person. Going on to lifestyle and social implications, the effects of ASD can cause very debilitating anxiety. It can cause social withdrawals from friend groups and loved ones. It can put strains on relationships. It can make it very difficult for you as the victim to want to reach out to people. It can really reduce productivity both at work and at school. It can really mess with your work ethic. It can cause just total dissociation. These are all common factors of ASD. Minor tasks, just like chores or something like that for a kid, would become much more difficult for them. cause and trigger this sort of dissociation for the victim. Flashbacks or anxiety, normal activities someone might have enjoyed before can cause this withdrawal to form. Now, something interesting to note is that there isn't a proper test to diagnose ASD. There's not really a test you can go and take of your own volition. It requires a healthcare provider to make the diagnosis after conducting a psychological assessment. Now, as for treatment, psychotherapy is the main treatment for this disorder. Specifically, cognitive behavioral therapy is especially effective. Therapy will always take place with a licensed mental health professional, such as a psychologist or psychiatrist. Other than that, there is medicine you can take. There is certain things that can be prescribed to you, but your best treatment is going to be psychology and talking to a licensed professional about the traumatic event. Prognosis varies a lot between people. If symptoms are untreated, it can lead to alcohol and substance use and abuse, PTSD, depression, panic disorder. In severe cases, it can lead to accounts of self-harm and attempted suicide and attempted harm of others. If treated and gone through properly with proper psychiatrists or psychologists, you can see yourself having a full recovery. And these are my sources.